Bonjour tout le monde. On va faire une petite mise à jour. On est rendu à Ontario 31 090 cas. C'était une augmentation de 230 depuis hier. So we're in Ontario, we're at 31,090 cases, which is an increase of 230. So it's a couple days in a row that we're less than 300. So we're seeing a downward trend. Le chiffre diminue, le chiffre des cas qui augmente d'augmentation chaque jour diminue avec le temps. Donc, ça, c'est des bonnes nouvelles. So we're on the right track when it comes to that. In terms of our local statistics, we remain the same. We have no other cases added. Our numbers have remained the same. We've continued to do our testing. Donc, au niveau des chiffres, on est rendu au même numéro que hier, 151 cas dans notre région, toujours 2 à l'hôpital, 1 aux soins intensifs, aucun changement au numéro de décès, aucun changement de flambée, quelques cas qui sont résolus de plus. So really no change in death status, no change in the number of long-term care facilities in outbreak. We continue to, again, monitor our long-term care facilities, our retirement homes as well. And we continue to do our testing, continue to be busy. Donc, on continue à faire nos tests. On est rendu à 7700 tests de fait. So now our testing numbers as of yesterday, Hawkesbury was 1,341, Cornwall 1,878, Winchester 1,022, Castleman 1,584, Rockland 939, 72 for Prescott Russell SDNG EMS and 116 for SDNG EMS. Donc, au niveau des tests, on est rendu à 1341 fait à Hawkesbury, 1878 à Cornwall, 1022 au Winchester, 1584 à Castleman, 939 à Rockland, 72 des paramédics de Prescott Russell et 116 des paramédics de SDNG. In terms of some of the other things that are going on, really, our today has been a day full of questions and full of inquiries about who can open, what can open, when can we open, and so on. So it's again, it's the list now. We have a bit of a better idea of some of the openings. We have on a pas mal de questions aujourd'hui. Vraiment, on est préoccupé par des questions des restaurants, les patios, les piscines, les plages, etc. On a beaucoup de questions. Donc, on est en train de tout préparer les documents. Il y a beaucoup de documents au ministère aussi qu'on pourrait partager avec les gens. So there's a lot of documents. We're preparing personal settings guidelines. We are just about to release a safe beach guideline. We're going to be releasing other guidelines as things open up. The ministry, again, has a whole slew of sort of industry-related precautions. So we're going to be linking to those as well. Again, my message is, yes, we're opening. Again, let us make sure that we are handling things in the same way with the precautions in terms of the precautions with hand washing, physical distancing. Don't go out when you're sick. Donc, c'est important. D'ici vendredi matin, on va avoir des centres d'achat potentiellement ouverts, les restaurants qui vont servir au patio et à l'extérieur. On va avoir beaucoup d'activités qui vont recommencer. Les bibliothèques vont ouvrir. Bientôt, on va avoir des camps d'été. Toutes ces activités vont être faites encore pendant la pandémie. It's important to say that these stage 2 openings and of activities and businesses are still under sort of that umbrella of we're still in a pandemic at this point. So we're still in a pandemic response. However, we're going to move forward slowly and just as we did collectively to be able to flatten that curve. I think moving forward, we should continue to have that curve flattened or have the odd case here and there that we can easily manage and contain. That's the name of the game moving forward. One of the announcements that was made today that was in relationship to the openings was the fact that the ministry now, the government now, is reopening childcare across the province. As you know, most of the childcares were closed, except for ones that had less than 5 kids, and except those that were specially made for parents, for kids of parents who work in essential services. Donc, on sait que aujourd'hui, le ministère a annoncé qu'il va rouvrir toutes les garderies à travers l'Ontario. Actuellement, les garderies étaient fermées, sauf pour celles qui avaient moins de 5 enfants et ceux qui étaient dirigés pour prendre soin des enfants des personnes qui travaillent dans les hôpitaux, dans les professions essentielles. So today, the government announced its plan to reopen. That was done in consultation with experts, and essentially, there are some specific rules to be adopted. For example, they're going to have cohorting, so they're going to have groups of no more than 10, including children and staff. Over the day. So these kids will be in groups and won't intermix with other kids in there. Donc, ils vont avoir des enfants mis en groupe de 10 maximum, incluant les professeurs les personnes qui travaillent aux garderies. Et cette groupe va être ensemble toute la journée. Ils ne vont pas mélanger avec les autres. Donc, ça, c'est une chose à faire. Il faut avoir un plan de dépistage. There needs to be a screening process. Il devrait avoir un record de qui a rentré à l'école, qui est rentré, qui rentre à chaque jour. Donc, they need to keep a daily attendance record. Obviously, cleaning, disinfection will be thorough within these settings. Il faut nettoyer, désinfecter, etc. Tout ça doit être mis en place. En effet, il n'y a aucune visite d'extérieur, makes sense, no visitors. Et aussi, il y aura des protocoles pour comment les parents vont aller chercher et laisser leurs enfants. So there are also going to be protocols for basically allowing safe pickup and drop off of the kids effective immediately. Operators now will be able to go into their facilities and prepare them for opening. Donc, les opérateurs des garderies qui sont fermés pourront maintenant rentrer pour les préparer pour qu'ils seront en fonction la semaine prochaine ou le plus tôt qu'ils peuvent après le 12 juin. So those are the things that are going on. I had a teleconference with our municipalities today, just reiterated some of the openings and some of the things that are more pertinent to them as well. I highlighted them, for example, summer day camps, talked about some of the guidelines that are forthcoming and some of the announcements that will be made, talked about the pool reopenings. They're getting set to open their pools. Aujourd'hui, j'avais une téléconférence avec tous les maires de la région et je donne une mise à jour au niveau des ouvertures, surtout qui sont pertinentes au niveau des municipalités, surtout les piscines municipales, à l'extérieur et à l'intérieur aussi. Et on a parlé un peu des camps d'été parce qu'il y en a des municipalités qui ont des camps d'été aussi. Donc, ça, c'était ma journée aujourd'hui. That was our date today, and I suspect it's going to be like that for the next while as we get things opening and as we answer more and more questions from people as well. I have a question here about, so I'll go to my questions. I've got one here. Can Dr. Paul comment on the World Health Organization about asymptomatic, rarely transmitted disease? That's a good question, Nelson. The whole issue about asymptomatic transmission and pre-symptomatic transmission has always been in question, has always been at the forefront of what we've been thinking about. Initially, experts were adamant because there was really no evidence of transmission before symptoms. That changed because what happened was they were seemingly individuals who had no symptoms, who essentially, said they have no symptoms and developed symptoms when they were tested. And when you went back to them and asked them, they said, no, I had no symptoms. And then they did a study and went back and asked individuals. And we ourselves had that as well, Nelson, in multiple cases where a person developed a symptom on, let's say, on a Monday. And what we so we had the positive result. We called them, got the tracing, got the history, and we asked them, okay, like how did you feel the day or two before? And they said, well, I really had any symptoms, but I was tired. I had a bit of a headache, like very mild symptoms. So I call those more not asymptomatic, but like what pre-symptomatic. So very mild symptoms that a couple of people said, "Oh, I had a backache." Like that's really a very mild symptom. So is it asymptomatic? There were not the typical symptoms. I agree. So I think that still there is validity to thinking that there may be transmission unknowingly before somebody develops them. And I know that the World Health Organization, said that there's little evidence to do that. However, I think we still need to be cautious. The other thing too is, I don't know if a lot of you know, I'm a microbiologist and immunologist. I got my degree before I became a physician at McGill, and I studied viruses and I studied, these, and a lot of the viruses that we work with do have actually most, if not all, the more common ones do have pre-symptomatic transmission. Very famously, influenza, measles, for example, chickenpox. All of these people can be contagious a day or two before they develop symptoms. So it's not unheard of for a virus to behave that way. But I do believe that this is because it's a new virus. I can't say it with certainty, but I do believe that there are a group of individuals that do not have maybe obvious symptoms or are asymptomatic. To what degree are they contagious? I'm not. That's another question. Are you contagious just because I do a throat swab, and you just have a small amount of virus in your throat before symptoms come out? Is that at the time that I took the test, were you actually contagious? Did you have enough virus to shed to spread to other people? Those are questions that we don't know at this point, but I still think that it's prudent. And so I would say about a month and a half ago, 2 months ago, but prior to that, when an individual came into us and had a positive test, we would look and say, okay, who were you in contact with from the first day of your symptoms? So we move forward. Now it's been about a month now, at least that, where our directive now is, because of this pre-symptomatic and asymptomatic type of transmission. Again, in many situations, it's pre-symptomatic, very small, subtle symptoms that people don't mistake as just being, I'm not feeling well, I'm tired, rather than anything else. Because of that, now what we do is we go back 48 hours. So let's say we have an individual that was tested on a certain day. We ask them, okay, when would your symptoms start? Well, what we do is we say, okay, where were you 48 hours previous to that? Just to be sure. So I wouldn't dismiss and say there's no asymptomatic or pre-symptomatic transmission. I think the prudent way to ensure that we ensure that we catch people who are contagious and sort of try to isolate them and their contacts is to go back 48 hours. I think that is a prudent thing. And again, it's not unlike what we have with other viruses. The other thing too is, can Dr. Paul address the Centers for Disease Control surfaces do not usually transmit the virus? Does that mean the advice of hand washing, wiping down surfaces? I think that, again, we know that for the most part, viruses and bacteria, and I can tell you that it's changed over what I knew 20, 30 years ago. We do know that the viral behavior, again, in general, viruses and bacteria can survive on surfaces or fomites, dust particles, or those type of things. We call them fomites. So it's not inevitable that a virus may survive perhaps even an hour or two, or, we know that some can go 48, 72 hours, but even if a virus for some reason survives an hour or two and you happen to go and touch the keyboard, within that hour, you'll get sick. So again, I think our prime way of preventing us from spreading it is to washing our hands and obviously disinfecting. So I still think that is important. That's really what we've learned from microbiology. The other, and then a final question that I have here is the EHU working with the Ministry of Agriculture, Food and Rural Affairs for migrant farm workers, and the reason towards possible mass testing these individuals? We know that it's being done there. There are special groups. We have actually had, we're involved, we're involved with migrant farmer evaluations and inspections before they come. There was a special protocol that was developed through the federal and Ontario governments that we followed. People were quarantined. At this point, we don't have an indication that we should be going. Our staff is going to be looking at that to see if we need to go and test them. At this point, like I said, we were quite these individuals were in quarantine for 14 days before they came here. But again, that is a good question, and we're going to review that. That's part of our strategy to look at high risk. Should we ascertain that there's a risk there, we would not hesitate to ask them to be tested as well. That's all for my questions. And unfortunately, I've got to go. I've got a 4:30 teleconference with the ministry. I promise I'll take more questions tomorrow. Thank you very much, everybody.